Gokul sir, the podium is yours.
Morning, sir. Thank you, sir. Respected Vice Chancellors, dignitaries, teaching and non-teaching faculty, other viewers, staff and students, a very good afternoon to one and all. I'm Dr. Gokul Devai. I'm an Associate Professor of Surgery and Additional Medical Superintendent here at Sri Sathya Sai Medical College Hospital and Research Institute. We are a teaching unit of Sri Balaji Vidyapeeth, Pondicherry. Now, there is no doubt that both the quality and quantity of medical services available have improved, not only in India and the world over. With the increasing number of patients visiting hospitals, there is also no doubt about the complexity of modern healthcare systems in providing patient care. The more complicated a process, the higher the chances of mistakes. And hence, now more than ever, the emphasis on patient safety practices has taken the limelight. In today's SBV Connect webinar, we delve into the various aspects of new and emerging trends in patient safety. Without further ado, let us begin today's scientific session. It is an honor to introduce our first speaker for the session. Professor Dr. Ashok Kumar Mahapatra, Vice Chancellor of Shiksha Anusandhan, deemed to be University, Bhubaneswar, Orissa. Sir has completed his MBBS in 1975 from MKCG Medical College, Berhampur, and Master of Surgery from All India Institute of Medical Sciences in 1979, following which he completed his MCH in Neurosurgery, postdoctoral degree from AIIMS in 1982. His interest areas include pediatric neurosurgery, head injury, skull-based surgery, among others. He has carried out 30 research projects in the last 40 years and authored nearly 900 papers, chapters, and books. Ex-Chief Neurosciences Center and Dean of Research, AIIMS, New Delhi. Sir is also the former Director of AIIMS, PBSR, former Director and VC of Sanjay Gandhi Postgraduate Institute, Lucknow, and the former HOD of Neurosurgery, AIIMS, New Delhi. Sir, it is an honor and privilege for us to have you here with us. Welcome, sir, and I hand over the platform to you. Sir, your mic is muted, sir.
Can I start? Good afternoon, Honorable Vice Chancellor Professor Parija, all the faculty, dean, and the students of the Balaji Vidyapeeth. It's a great honor for me to deliver the lecture. And today's talk is patient safety. We all know that patient care has improved tremendously in the last 50 years. If we go back to the medical history, there are no medical colleges before 1835, and during independence, there are only 7 medical colleges. And we, in 1944, the board committee report, we created a large number of medical colleges, and today we take more than 80,000 undergraduate students and 43,000 postgraduate students, and there are approximately 590 medical colleges in the country. But if you look at the quality medical education and quality education in India, none of our university figure 200 figure in the country. However, the life expectancy, the quality of life, quality of hospital care has improved tremendously. However, we still have tremendous scope to improve our medical facilities, medical care, our attitude, and overall patient satisfaction. I remember I spent about 42 years at AIIMS Delhi. Every 6 months, we ask patient satisfaction, and it is always less than 70%. The month it is above 70%, we get a congratulation letter from the director of AIIMS that this year, this month, or this fortnight, the satisfaction rate of the patient and their relatives more than 70%. So we know that patient is very, very important, and we revolve around the patient. So if you look at a medical profession, we stand in three legs. One is medical education, second is patient care, and third is the research. When we take interview to our faculty, we ask, if you have 100% time, how will you divide? Out of enthusiasm, a lot of people say, I will divert my 70% for research, 10% for medical education, and 20% patient care. I think this pyramid and attitude is wrong. We are basically for patient care and medical education, then research. So when we talk about patient care, today the patient care has improved leaps and bounds. And we have super specialization and more super specialization and sub-specialization. Even in neurosurgery, we talk about pediatric neurosurgery, skull-based surgery, vascular neurosurgery, traumatic neurosurgery, so many super specialties. So today there is no point of telling I am getting good care. Can we have the top class care to our patient? Then the question then, it is our attitude to the patient, the safety of the hospital, the delivery of the healthcare, and overall satisfaction of patient and relative is very important. So when you talk about patient coming to hospital, it is a wholesale responsibility of the hospital management to see patient enters and goes away safe. So it's a very important parameter. When we are student, maybe 50 years back, nobody was talking about patient safety because there are very few doctors. And if you look at 70s and 60s, there are less than much required. We need about 18 lakh doctors in this country. In last 75 years, we have produced about 7.5 lakh doctors. So we are anyway deficient by about 12 lakh doctors. But that should not make it complacent that because you are less in number, we give less quality treatment. So in the hospital, patient care has tremendous value so that you make your brand. When you talk about AIIMS or PGI or even SGPGI or your Balaji Institute or Pondicherry JIPMER, they have produced a brand over the last 30 to 40 or 50 years. So we have wholesale responsibility to see patient is safe and get best treatment in your hospital. So what are the parameters you have to see? It is important for the part of the hospital to see the patient is safe. It reduces the hazard to the patient so that patient can come and go within a shortest period of time, so that your turnover patient care and attendance to the OPD, more credible data you produce, more concern you show to the patient will have trust and also faith. So we, the doctors, should create a faith in the patient care system so that patient comes and get treated in our hospital. The facility is important, but most important is the attitude and accountability of the hospital patient caring system or hospital employees. If the hospital employees are not accountable, not concerned, whatever facility will create, it is not going to give the desired result. So to improve the quality of hospital care, it is very, very important to see the patient safety. So what are the principles of safety? The quality of healthcare. So if we have to give a good quality healthcare, that includes patient safety, because if the patient is not safe, whatever quality of care you give, he is not going to be happy. Reduce and minimize the hazards. Hazards in the hospital, in the food provided, in the surrounding, the environment and ambience. So everything gives an impression that patient doesn't get any side effect, complications, hazards from the hospital. Minimize the recovery time. If I operate 5 and all go well in 5 days, it is better to operate 5 and send them home 5 days than operating 10 and having a hospital stay of 8 days. So 1 day extra hospital stay means it amounts to millions of rupees and dollars. So our aim, when I went to AIIMS, average neurosurgery patient used to stay for 10 to 15 days. Today, if a routine neurosurgery operation is done, they have to leave within 3 to 5 days. There is 2 days before admission and 3 to 5 days after surgery. So that is the routine practice at a good hospital. So we should see that our patient have shortest pre-hospital care and shortest time in the before whatever specific treatment you give, and then the shortest time before he get discharged. There is a different principle. There are also the principles supposed to be done by doctor, nurses, paramedics, technician. So it is all account with one package of patient safety. First thing we have to see what the risk patient has in the hospital. Can we identify these risk factors when the patient comes in and goes in? What are different types he is going to face? So unless we know what are the factors which can influence the patient, we will not be able to prioritize or manage them. So it is very, very important to learn what are the prioritizing the management system of the risk factors which patient like to undergo. So we have to have capacity of learning, follow up with the problem, implementation the solution. If somebody has got something problem, we have the prevention and implement of solution. Because overall patient will go and make a good name or bad name of the hospital. If the patient is not safe, whatever quality of care you give, maybe surgical, medical or otherwise, you're not going to have been satisfaction level will be not very high. So there are role of the doctors, paramedics, nurses, and many factors which also pay for patient safety. Among these factors is the environment and other roles come. What are the specific role the sisters have? They have to monitor in the ICU, they have to see the patient in pre-operative period, post-operative period, ICU, nursery, and many places where the sisters play important role in safety. The first thing is that if something is going wrong in the hospital, it is the first person in nursing staff who have to detect what is going wrong. So if they miss it, it's not good for the hospital that some hazard which is going to happen or happen to the patient is missed. It is better to detect them early. Prevention is better, but if something has happened, the nurses or the whoever there should detect it and inform to the medical personnel. So in a weak system, chances of hazards are very high because people are not accountable, infrastructure is not adequate, whatever is there, people's attitude does matter. So most important in the hazard reduction is infrastructure and credibility and attitude of the persons. So these persons include medical professionals and paramedics. So it is very, very important to understand demography. What is the risk of the patient in the hospital? What age group is he? What type of illness is carrying? Suppose a person is suffering from the infectious disease. He has having hazards for non-infectious disease. But so that it's for our COVID. If we have COVID and non-COVID in the same hospital, only difference of floors or the blocks, then people can carry infection from one to another place. So these are the hospital hazards. One can realize what is the demography, what is the illness pattern, where the patient should go, what are the importance of the hospital care provider in relation to safety. We cannot always blame the administrator telling that they have to do everything, we have nothing to do. So the knowledge and the detection by the hospital worker, the hazards are very important. Early diagnosis, early detection, and quick solution to the problems are very, very important for the hospital care personnel. So we have to understand there are different patient safety guidelines by NHS, National Health Scheme of Europe. So to reduce or avoid the patient problem, harms to patient, the treatment and quality, dignity and sincerity. We may be giving very good quality of treatment, but if we disregard the patient, we do not give them dignified status. The patient is like, I always say, patient is like a god. We are the server and hospitals like temple. Unless doctor think we are the worshipping our God through our patient, and a hospital is like a temple for the doctors. Unless we have that type of concept, you cannot be sincere and honest and dignity you cannot provide to the patient. So it's very, very important. These factors should be very often overlooked, but should re-emphasize so that doctor do not forget these very important factors. So if you have to reduce the safety, you have to insight. You should be able to understand what is going wrong, and if something is going wrong, you have to detect it early. And for that, it requires 100% involvement. If I have to work only 8 hours or 6 hours, that 6 hours I should be completely involved. There should not be other way. My mind should not be diverted so that something is going wrong, I could not detect. Sometimes what happens, there may be some smoke in the hospital, some short circuiting people miss. These are hazards in the hospital. When a short circuit, I have seen many hospitals catch fire because when it is small fire or smoke, people did not report and ignore it. So it is very, very important to see their involvement and their attitude and safety culture. It is very important that we never teach our students or faculty what are the safety culture, what are the parameters, how should they concern so that maximum safety can be provided to the patient and the relative. because they are going to be your ambassador so that your hospital have a good name or bad name. So there are regular courses of the patient safety in NHS. But I'm sorry that I don't think any hospital give any courses on the patient safety. That is the reason I think our autonomous institute should start diploma in patient safety system and degree in patient. These are the educational course, but the people should be specifically trained to see the everything in the hospital goes right as much as possible. So there should be a framework of the patient safety. And this safety is sub-stratified or strategy should be there. So what are the step 1, step 2, step 3? If something has gone wrong, how quickly your response and how quickly try to remedial measure. One can be have short-term strategy and medium-term strategy and long-term strategy. If something going wrong, let us say there is a ward is getting continuously infected, patient post-operative get infection. We have to find out why this type of hazards comes. Is there a contamination somewhere, the pipelines? Is there sanitation of that ward is wrong? If the sisters are not taking proper care, if the sweepers is not cleaning the rooms properly, whether the sanitization done, OTs are regularly either fumigated or de-infected. So many things goes wrong like that because small things matter. So our strategy has to, once we identify a factor, there should be short-term planning, long-term and medium-term. In the long term, suppose a operation theater is soaking water and there is fungus in the wall. It is not a healthy situation. It smells, it causes infection. So we have to see what is the long-term planning. Many times this happens in big hospitals also. So overall, one has to have framework, safety strategy, long and short-term planning. We have to also know what are the methods available in the hospital safety system. Actually, we do not teach our student either in internship or MBBS the patient safety method. We always believe after working some time in the hospital, they will know what are the hazards in the hospital, whether food contamination, water contamination, chance of getting infection, sanitation. These are all produce hazards for the patient. So we have to have methods and ways to reduce it. And this can be only done by educating and producing standard protocol. Unless we have standard protocol for the hospital employee who can be repeatedly given a short-term course or training or lectures that what are the safety standard and how do they have protocol-based safety standard in the hospital. These are very important factor because very quickly people forget what are the safety standard. So, suppose something has gone wrong, you have to have public reporting. You have to inform your higher authority, medical superintendent, maybe your principal of the medical college or dean of a institute. So these data has to be reported. We are always afraid that if I report something, action can be taken against me. But what we don't understand, if I don't report, the larger picture will be more people are going to suffer. So it is very important to properly, dedicatedly, timely reporting things. So the comprehensive accuracy is necessary. Unless we know what is we are reporting, sometime out of enthusiasm we may give a wrong report. So our data must be correct. Our capturing of the items or parameters. Suppose a hospital is getting air condition infection, fungus infection from air conditioning, and the water which is used in air conditioning is wrong. So we have to see why there is infection, fungus coming through the duct, air conditioning duct. So there are many things like that. So healthcare professionals should have time to time data. They should do quality assessment and they should research in the safety method. If the safety of 2020 was X, we can make X plus something Y in 2025. Unless we time to time assess our safety method, we have a protocol-based parameters. Our people working in the hospital care system are not educated. They do not have a training time to time. Then our system should not be neglecting the hazards, which can be temporarily or permanently can be solutions. So it is very important to change, train, and also have attitude of the change of the hospital employee. So there are many safe indicators regarding the national policy, there are the patient safety indicators, and US also they have database for patient safety. So we have lot of reference in this regard. If we look at the BMJ and other medical periodicals, there are a lot of things are given on patient safety, how to detect, deal, and eradicate the patient safety system. So in new standard of patient safety, there are different parameters. So these parameters will be human parameters, environmental parameters, and also remedial parameters. So we have to see, is the hazard by the environment, is by the manpower, or it is our everything is there, no implementation error. So we say human error is always there. We cannot say that human being is 100% perfect. So you train, motivate, educate a hospital employee to reduce the error so that patient have less and less hazards. So sometime there is omission and commission hazard. Something goes wrong, we try to suppress it. But this is not good. The employees should be trained to honestly report these things. So there are safety standards in Australia, US, UK, and many things, and quality assessment. There are many points to quality assessment, the hospital hazards, and this must be taught to our undergraduate and postgraduate and time to time. So we have National Patient Safety Policy of 2020-2022, and our aim is to provide maximum safety to patient. And if we do not provide, then we will be doing injustice to patient. So when a patient health care, this is the overall work of the doctors, paramedics, technicians, nurses, and administrators should take full cognizance of the thing and improve the infrastructure, raise the awareness, try to get the feedback so that remedial measures can be taken. And there are a large number of data available in the patient safety care and hospital, and prevention is very, very important. I gave an example of infection in the ICU, in the post-operative ward, identify the risk, detect it, and prevent it. So I think it's very, very important for us to understand that when the patient comes to us, they are 100% dependent on us, and they almost practically surrender us for any problem. And we have the tremendous moral and responsibility, social responsibility to see that patients do not get extra hazards from the hospital. So we have to see what are the factors for the hazards: human error, environmental error, treatment error, or negligence. Everything can be part of a hazard which a patient can have in the hospital. If we do the short-term remedial measure, medium-term remedial measure, and long-term, because if an operation theater is leaking, we can have an immediate method that see what can be done. But if there are fungus infection ward, we have to close down short time and see that. Many things are like that. So immediate action, intermediates are mid-term action, and long-term planning. So unless we have strategically managing our hazards in the hospital, we will not be able to deliver the right thing. So I think overall we have a tremendous responsibility to see that our patients are safe. They do not have unnecessary hazards. They are already coming a very, very psychologically upset stage. We cannot give them more and more risk in the hospital. So the hazards and risks in the hospital can be minimized by having technical courses, motivating lectures, improving the environment, and overall changing the attitude of the hospital worker. Thank you very much. Thank you.
Thank you so much, sir, for that enlightening talk. Sir, among the many points that you put forth, sir, patient safety standards is something that is already defined. However, I think the real challenge, sir, is in inculcating the culture of safety, like you rightly said. And for that, the patient safety syllabus, something that various universities can take up, is something I think is a very nice message that will reach all our audience. Thank you so much for this enlightening session.
I think we should start courses, diploma or short-term training in these courses. I think India, there is no degree or diploma or curriculum for patient safety. That should be ideal. Okay.
Thank you so much, sir. So I would now like to introduce our second speaker for the day. Professor R.S. Neelakandan, sir. Professor R.S. Neelakandan, sir, is Honorable Vice Chancellor of Meenakshi Academy of Higher Education and Research, deemed to be University, Chennai, Tamil Nadu. Professor R.S. Neelakandan, sir, has been a pioneer in the field of oral and maxillofacial surgery since 1987. He's an alumnus of the Madras Dental College and was the best outgoing student in his batch. He is especially interested in surgical oncology, reconstructive and regenerative surgery, and has completed advanced craniofacial and distraction osteogenesis training at Leipzig University, Germany. He has to his credit over 50 international and national publications and has authored a manual on distraction osteogenesis. He has conducted extensive research in the field of distraction osteogenesis of the facial skeleton and has earned 3 notable patents for his distraction devices during his tenure in the field. He was the president of the Association Oral and Maxillofacial Surgeons of India in 2016 and was also the advisory committee member of the Senate of Tamil Nadu, Dr. MGR Medical University, Chennai. Sir, it is an honor and pleasure to have you here with us today. We hand over the platform to you, sir.
Yeah. Screen button. Share. Share panel. Screen. Okay. Good afternoon, ladies and gentlemen. Am I audible?
Yes, sir, you are audible.
Yeah. At the outset, I thank the Honorable Vice Chancellor, Professor S.C. Parija, and the organizing team to have given me this opportunity to present in this learned forum on patient safety, new and emerging trends. My topic of today's presentation is system changes to improve patient safety. The first line of the Hippocratic oath we all have taken as physicians and surgeons is to do no harm. The publication of the Institute of Medicine's To Err is Human served as a catalyst for a growing interest in improving the safety of healthcare. Despite the extensive attention and public commitments towards patient safety over the last 2 decades, levels of avoidable harm in healthcare around the world remain unacceptably high. It is thus imperative for all the practitioners to understand the importance of establishing patient safety system in their practice. Coming to the WHO definition, the WHO has defined this process as the reduction of risk of unnecessary harms related to the healthcare to an acceptable minimum. Today, we'll be briefly going through the following topics regarding patient safety under the following headings: leadership, culture of safety, documentation, medication safety, surgical safety, strategies for the design of safe systems of care, and finally my conclusion. In a solo practice with a single physician, he or she becomes the de facto medicine director of patient safety. But in a large setup with multiple doctors, although all are responsible, there is usually one physician appointed as medical director of patient safety. The medical director of patient safety has the responsibility to oversee safety process and ensure their application, develop policy procedural manual with periodic review, credentiating and privileging documents. And also, he or she should establish a culture of safety and to conduct mock drills. A culture of safety refers to having the entire workforce oriented towards the best safe practice. Here, the primary concern and responsibility will be to keep the patients safe. Any unintentional errors and deviation from accepted protocols may be unpunished, but should be dealt with appropriate coaching and retraining. Punishment through employment action shall be reserved only for gross, careless, and negligent, any careless negligence, and all the medical staff must be encouraged to report unsafe practices, near misses, and actual adverse events. Coming on to the documentation. The medical staff need to be responsible for credentiating and privileging the site shows a sample privileging from our patient investigation when it comes to the maintenance of patient records. Electronic medical records are preferable in today's modern day and age. Care must be taken to ensure protection of patients' privacy. These systems must be validated for the Health Information Portability and Accountability Act compliance. Coming on to the electronic medical records, it should ensure the following: the electronic medical records. Number one, health maintenance, prompt and proactive care, medication management, and complete patient documentation, inter-office communications, and he or she also should remind for patients of upcoming appointments, review all no-show patients' records periodically in order to follow up at a later date of possible, and then to alert doctors by displaying preventive measures or any routine screening the patient's due for. Coming to the medication safety, patient record must include the entire history, including history of allergies, list of medications that the patient is currently taking, and potential contraindications. The drugs prescribed must be entered in patient's record. Verbal orders must be avoided and use check back technique wherein the prescription is reconfirmed with the clinicians before dispensing. Handwritten prescription should be avoided and if necessary must be in all capital letters with correct mention drug dosages.
Sir, sorry to interrupt. Your slide is not moving, sir.
Oh. Now is it okay?
No, sir. No, sir.
Am I on medication safety now?
No, sir. Your slide is on the content page.
Oh. Content page.
Stop sharing and redo, sir.
Okay.
Now is moving, sir.
Okay.
Sir, make it full slide, sir.
Okay. Full slide put. Medication safety. Now is it clear? Now is it moving?
No, sir. It didn't come to full slide, sir.
Full slide வர மாட்டேங்குது. No. Now, do you get the full screen?
No, sir. Sir, could you change to next slide, sir? We'll see whether it is moving, sir.
Now you see surgical safety. I am on surgical safety. Are you getting the full screen, ma?
No, sir. It is there in medication safety.
Now is it on full screen?
No, sir. Yes, sir. You can proceed now, sir.
Is it okay? Medication safety I am on, and do you
Yes,
get
sir.
the full screen?
Yeah, there, sir.
No.
Continue, sir.
Are you getting the full screen, ma?
Yes.
Okay, now I'll go to the next slide. You see, surgical safety. Is it moving?
Yeah, yes, sir. Yes, sir. It is moving, sir.
Okay, I'll again run through the medication safety.
Yes, sir.
So coming on to the medication safety, the patient record must include the entire history, including history of allergies, list of medications that the patient is currently taking, and the potential contraindications. The drug prescribed must be entered in patient's record. Verbal orders must be avoided, and the use of check back techniques wherein the prescription is reconfirmed with the clinicians before dispensing. The handwritten prescription should be avoided, and if necessary, must be in all capital letters with correct mention of drug dosages. Appropriate storage and dispensing of injections, medications, sample drugs, and emergency medications should be ensured. Patient to be given clear instructions regarding the appropriate use of a medication. Use teach back technique, wherein the patient is asked to teach back to the clinician on the appropriate use of the prescribed drug in order to ensure a proper understanding. Next, coming on to the surgical safety, the following points have to be ensured. Qualification and competency of the doctor and other staff. Ensure that operator is well rested. Sterilization and maintenance of surgical equipment is looked into. Training staff on correct use of surgical equipment should be ensured. Availability of emergency medication or cardiorespiratory support equipment should be doubly checked in the office, and safe administration of anesthesia, monitoring of anesthetized or sedated patient should be done. Also, ensure that a friend or adult family members to escort the patient home after any office procedures that needs sedation. And then the patient has to be reviewed after 48 hours. Patient should be given written preoperative and postoperative instructions, and informed consent should be documented before any surgical procedure, and the use of surgical checklist must be a standard protocol. Here is an example of a surgical checklist prescribed by the World Health Organization. It has the points to be checked prior to induction of anesthesia, prior to skin incision, and prior to the discharge of the patient from the operating room. All these instructions given by WHO has to be implicitly followed. So coming on to the strategies for the design of safety system of patient care, the three pillars of the strategies for design of safe system of care are to work actively to prevent errors. Now, no matter what is being done, errors do happen. Understanding that and reporting those errors to make it visible is the second step. This helps in avoiding that error in the future is ensured. Now, once an error happens and it is reported, all the focus must be on mitigating the adverse effects of the error and ensuring the best possible results for the patients. So, to conclude, I would like to say that much is to be learned about how to design healthcare systems that are effective and safe. However, a solid foundation of knowledge and methods exists on which to build these healthcare systems that both patients and clinicians deserve. Thank you all for a very patient listening.
Thank you, sir, for the enlightenment. Like you rightly pointed out, sir, one of the statistics show that in patient safety, medication safety is one of the biggest areas where errors occur. And thank you for the check back, teach back points that you put forth, sir. And as the teaching institution, writing prescriptions in block letters is one of the biggest challenges that we face, and we try to implement. But yes, so your points are well taken, sir. Thank you so much, sir. Thank you so much for your talk.
Thank you. Thank you very much.
It is my honor and privilege to now introduce our third speaker, Professor Subhash Chandra Parija, sir, our Honorable Vice Chancellor of Sri Balaji Vidyapith University, Pondicherry. Sir is an eminent academician, erudite microbiologist, researcher, keen votary of medical education and able administrator. As a former director of JIPMER, Pondicherry, sir is also an author of 16 books and 400 plus research papers in national and international journals. Sir has been listed among the top 2% of scientists globally in the field of tropical medicine. He is an expert member on FAO WHO on foodborne parasitic diseases, and sir has received the Dr. B.C. Roy National Award in the year 2003 for his notable contributions to the development of medical microbiology. Sir is also the founder of the Indian Academy of Tropical Parasitology and has been confirmed with various fellowships such as the FAMS, FICA, FABM, FMC, FIMSA, and many more. Sir, it is a privilege to have you here with us, sir, and I hand over the platform to you.
Thank you very much, sir. Am I audible to you all? Am I audible to you all?
Yes, sir. You're audible, sir.
Esteemed my co-speakers, Vice Chancellor of Sham University, and Nilakanthan, esteemed Vice Chancellor of Field, and all dear participants for today's stream. Fraternity, Sri Balaji Vidyapith, and our chancellors, Sri Indira Gopalan, I'm really thankful to my previous speakers. Was nicely elaborated on these aspects, strategies, and importance of this field. So today, what I'm going to say is the patient safety right. Patient safety and quality care, tertiary care teaching institute. Is my slide moving?
Yes,
My-
sir.
Yes, sir, it is moving, sir.
Okay. Now, when we talk of listen, safety, healthcare disciplines, sharing medical providers, speakers, colleges affiliated, sciences, like ours, other entities. Special care, patient safety, over the last 5 decades, is doing more and more care discipline. Today, we conceptualize patient safety 5 decades back. Remember when I was a student, now when we revisit the concept of patient safety in healthcare delivery, it has changed drastically. Many positive developments have taken place. Include integration of component of patient safety in our curriculum, different parts of the curriculum, undergraduate and postgraduates, and improve patient safety by improving the skill and competency of the clinical healthcare providers, clinicians, through simulations and other methods. And to have
Excuse me, sir.
components that
Excuse
could
me, sir.
avoid errors.
Excuse me, sir. Your voice is breaking, sir.
My voice is breaking.
Yes, sir. Your voice is crackling or breaking, sir.
Yeah, slightly. Okay, I'll be nearer to. Yeah, I'm trying. Now,
This is
now
comfortable.
maybe
Yes, sir.
is it comfortable now?
Yes, sir. You're comfortable, sir.
Yeah. Thank you so much.
Thank you, sir.
I cannot sound. So when we define as for WHO defined patient safety is a healthcare discipline that aims to prevent and mitigate risks, errors, and harm that occur to patients during provisions of. I think many important components of this patient safety has been nicely elaborated. And as he has mentioned, also now I'm mentioning, during last many years, many decades, this patient safety has been evolving. Complexity of healthcare systems and through the resulting rise of patient in healthcare systems. Most important component of patient safety, that is what we are looking at in this 21st century, is the continuous, sustained improvement based on learning and adverse events that has taught us to address those solutions and to contribute more and more for patients. Just to give you an example, how this patient safety becoming a concern, some data. 134 million adverse events occur every year in hospitals spreading across the middle income countries. That has occurred. Unsafe care delivery system, resulting in millions of deaths. That are the multi-factor. And this another survey has revealed that occurrence of adverse events to unsafe care is linked to one of the 10 leading causes of death or disability involved. It is the most important point concern that patient safety is contributing and becoming one of the top 10 leading causes of infectious as well as non-infectious. One study has shown around the world, as many as 4 out of 10 patients are harmed at the level of primary or outpatient healthcare services. Unfortunately, those 4 out of 10 patients, out of that, 80%, 3 patients, the harm could have been prevented. And of various factors that have contributed to this harm of the patients that had occurred. There are many important factors that are contributing to harm. These 4 out of 10 patients include improper diagnosis, wrong precipitations, and most importantly, use of inappropriate or irrational medicines. That is the crux of the safety across most of the hospitals, even in developing and also developed countries. Now somebody asked question, why this patient had question? Nobody does intentionally. Because some of the things that are lacking, that has not been properly integrating very systems. This is because the increasing complexity in healthcare setup are directly responsible to make humans more vulnerable to disease. For example, a patient in the hospital might receive wrong medication because of mixture or similarity of the drugs packages. But now one has to analyze responsible. Obviously, first blame comes to those person who are mistreated. It's usually the common things. However, in this case, when one analyzes the level of resistance, it passes through different levels of cares. Doctors, pharmacists, and juniors, residents, and interns who give the medications, supervise the medications, and finally, us who administer the medications. Even it has gone to different states because of this fault, somebody suffering. So many factors in this system that has contributed harm to the patients are many often ignored. So these factors which are ignored are usually called as latent errors. It is when these multiple of latent errors align, then that is reflected active errors in the patient, which are the decision unit. So when we think of error, the error is human. And we explain the flawless performance, humans working in the complex system of healthcare nowadays, with a high stress environment, deliver the best is definitely unrealistic. But definitely, errors can be minimized when humans in the system the task and the process, they were optimally coordinated. So in these three levels, the personnel, the system, the tasks and processes of administration of the task, there is more coordination. Then obviously it will definitely minimize errors. Therefore, focus on the systems that allows errors and this improvement can only occur in open environment where the safety culture is all problem. This brings fact as primary importance in changing the attitude to adopt the working culture. Safety work. The most share of safety lately. Therefore, a high level of importance has to be placed on safety values, which appreciates amongst those students. But when we have analyzed burden of harm is being increasing and more and more millions of patients are suffering injuries, dying because of this unsafe and poor healthcare practices. And coming to another important fact, healthcare associated infections, HI. Patients staying in hospital. 7 out of 10 every hospitalized patients. High income. Middle income. And disturbing features of this hospital-associated acquired infection is that they are caused by the most of these pathogens, bacteria, parasites, that proving resistance. Commonly acquired. So, in this, there are many situations. Patient safety is being compromised. For example, if one is not careful about safe injection practices, definitely unsafe injection practices, patients are at risk of suffering from injectable pathogens like hepatitis B, hepatitis C, HIV, and that study has shown that around 9.2 billion years of high loss, disability and disease, known as disability and disease. So it becomes a great economical loss. And another important component is wrong diagnostics, diagnostic errors. This occurs in about 5% of adults in outpatients hospital settings, and of which nearly 50% of those have the potential to cause harm. And the fact that most people may suffer diagnostic error in the lifestyle. Unsafe plastic and the data analyzed collected from a group of 51 country source. There are average incidents of 8 across 1 lakh distributions. Radiation errors is another situations that contributes overexposure to radiations and cause a patient alongside diseases. review of 30 years of publication have shown overall incidence of radiation error of 15 out of 10,000 cases. And sepsis. Sepsis. Patients hospital acquired infections, and that has which are further aggravated by these infections which are resistant to antibiotics. These two factors, sepsis and infections, sepsis caused by the pathogens that are resistant to antibiotics, really cause deterioration of the clinical conditions downstream. And found out observed 31 people worldwide, over 5 million deaths. Again, another better from embolism of blood clot was preventable for the sepsis. So in essence, patient safety situations can be due to many factors. Hospital acquired infections, due to radiation errors, and blood infections by the hospital resistant antibiotics, and venous thromboembolism of blood because of complicated or long hospital access. So how World Health Organization is doing? So they have endorsed the establishment of a patient day, that is on 17th September. Days back. Celebrated World Safety Day. To make the clinicians, to make the patients, to make all healthcare providers the importance of this safety and safety of the patients in terms of celebrating World Safety Day on 17th September. The purpose of World Patient Safety Day is to ensure patient safety by increasing public awareness engagement, such like this programs, academic programs, sharing of the information, webinars and all those things, enhancing global understanding of market towards global solidarity. And there are safety organizations, for example, International Society for Quality Healthcare, Joint Commissions, the Quality Council of India, National Accreditation Board Hospitals and hospitals, join their hands and working to ensure patient safety, to reduce mortality and morbidity in these patients. This awareness programs, patient safety, play a very key important role that makes the healthcare providers and healthcare receivers understand more patient safety. So this gives an opportunity for the healthcare workers about the values and importance of patient safety, like sensitization of lookalikes, sound alike drug list. Atropine, for example, sounds like atropine. Sensitization of the official, not use of the uses. International union is very other. Many examples are there which are being tested and paid so that errors because of this thing. Safety, which we are celebrating every year, 7th September, is as many important as important highlight. Make people aware of in all the countries, can be more ensured. Strongly implement, minimizing definitely morbidity and mortality. Hence, to summarize, the spectrum of business safety is comprehensive. Therefore, warrants a holistic approach. Higher safety beliefs, values, and above all, working culture of safety. Definitely, all these components will imperfect our one that will contribute. Thank you very much for this.
Thank you so much, sir, for that very elaborate and comprehensive talk on patient safety. This brings us to the end of today's webinars. Dear viewers, please feel free to share your views or doubts, if any, in the chat box, along with your email ID, and we will reply to you personally. I would like to thank our speakers, Professor Subhash Chandra Parija sir, Professor R.S. Neelakandan sir, and Professor Ashok M. Mahapatra for their time and words of wisdom. I would like to thank all the members of the organizing team for their effort and commitment in making today's webinar happen. And I would also like to take this opportunity to thank the management for providing us with the platform to implement all our plans and conduct such programs. Thank you, sir. Thank you, everybody, and have a good day.